Minoxidil side effects, what you need to know. Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Many of our viewers who are coming to our channel and they have requested us that they want to know more about Minoxidil and its side effects. So for this reason, today we have taken this topic and we'll be discussing in detail about Minoxidil and its side effects. We'll be diving deep into what are the side effects that you must be aware of if you are using Minoxidil or planning to use Minoxidil. So if that is so, please remain connected and watch this video so that you don't miss out anything regarding this. So friends, before we talk about side effects of Minoxidil, I'll just give you a brief introduction what is Minoxidil. So Minoxidil is a topical medicine which is applied for hair loss as common like alopecia androgenita and sometimes for other causes of hair loss also. It is over-the-counter medicine and it is usually available as a spray or as a liquid where we either use as a dropper or a spray and apply it twice daily. And it works by increasing blood supply to the hair and increasing the hair growth. And it is a very common medicine for hair loss that's available for last 20 years. Minoxidil initially was an anti-hypertensive medicine, but later on we found it useful to increase the hair and to called hypertrichosis, that is increase in the hair growth wherever it was applied or used. So let's understand how Minoxidil works. Minoxidil basically works by being a vasodilator. It widens the blood vessels, increase the blood flow and nutrients to the hair. This it does by various mechanisms, by relaxing the blood vessels, by increasing certain vascular endothelial growth vectors. It increases the anagen phase of the hair, decreases the telogen phase, which basically increases the life of the hair, and also it makes the hair thicker, more denser, and it decreases the immune reaction that is happening and that is damaging the hair. So all these things combined make Minoxidil an ideal and a very unique medicine to increase the hair growth. So these are the various mechanisms by which Minoxidil increases the hair growth. So let's look into the side effects of Minoxidil. As I said, Minoxidil is a very wonderful medicine to increase your hair growth. But every medication has its own side effects and Minoxidil is not an exception. There can be some side effects that can happen with Minoxidil even if we are using it topically or applying it topically. The first side effect that get is the scalp irritation. Now Minoxidil can cause itching and irritation in the scalp, and this irritation can depend on many factors like that vehicle that is used. Sometimes Minoxidil is an alcohol base. Alcohol can be irritating. Sometimes some preservatives are used that can cause irritation in the scalp. The concentration of alcohol also matters. Higher the concentration of Minoxidil, more irritation can be there. So these are the various things that can cause irritation. To control this or to manage this, we can change the preparation of Minoxidil. We can come to non-alcohol based preparations of Minoxidil. We can decrease the concentration of Minoxidil. We can shift from solution form of Minoxidil to foam form of Minoxidil. So like that we can change the quality and the type of presentation that the Minoxidil is having. The other thing that can happen with Minoxidil is the dryness and the flaking. So dryness and flaking is a very common thing with the Minoxidil use. The hair become very frizzy, dry, rough, and we need to add some moisturizers and conditioners in order to make the hair quality better. So usually we have to combine Minoxidil with some hair serums, conditioners, moisturizers, and use good shampoos so that we maintain hair in a good shape and we can moisten them, make them soft and silky. So that's another thing we have to keep in mind. Then increased hair loss. Now this is very paradoxical that Minoxidil, which is used for hair growth, initially can increase the hair loss. But this hair loss is not a permanent thing. It's a temporary phenomena which settles down usually a month or two. If you're starting Minoxidil and you experience the hair loss, do not stop using Minoxidil because this is something that will settle down and then later on your hair growth will increase. So that is something you have to keep in mind. Now another thing is there can be some systemic side effects of minoxidil. If minoxidil is absorbed, it can cause low blood pressure, it can cause vertigo, dizziness, fainting thing, and increase in the heart rate or tachycardia. These are things that can happen if minoxidil is used in higher concentration and is absorbed in the circulation. If this is so, then you have to talk to your doctor, you have to change your concentration of minoxidil, or maybe you have to shift to some other medication if it is not suiting you. So friends, very important when you're using minoxidil, you must use the right technique and right amount of minoxidil. I'll tell you what are the few things that you should keep in mind. In females, when you're using minoxidil, it is very important that you use minoxidil only during the daytime. Don't use it during the night. The reason is minoxidil in the night can be transferred to your pillow covers, and from there it can come onto your face. And in females, it can cause increased hair growth on the face, which is called hypertrichosis of the face, which is not something that we want in females. So in female, use minoxidil only in the daytime. The second thing is when you're using minoxidil, use it in the right proportion. That is, we need 1 ml of minoxidil at a time. Don't overuse it, don't increase the amount of minoxidil, because it will not speed up the hair growth. It will take months. Normally 3 to 4 months are needed to give you good results. So you must have patience to get results. Number 3, when you are using minoxidil, try to see that your minoxidil is not dripping into your forehead or your face. If minoxidil will come on your face, it will increase the hair growth on the face. So keep your head tilted backward and then apply minoxidil so that it is not coming on your face and it is not causing undue hair growth on the face. So these are few precautions that you have to keep in mind. And if you still have problems, then consult your doctor that maybe the type of minoxidil that is being used need to be changed or concentration need to be changed. Now, if somebody asks that in which conditions minoxidil should not be used, then they are very rare conditions. One of the rare conditions is that the skin of the scalp is very sensitive and it cannot tolerate any lotion like minoxidil. Or if there is some allergic or contact dermatitis to minoxidil, then this is something that we should not be using. There are some people who have got migraine, and in these, when we use minoxidil, sometimes their headache and migraine can increase and then they cannot tolerate minoxidil. So these are few cases where we have to avoid minoxidil. Otherwise, it's a very safe medicine to use topically and can be used by most people. Another thing I would like to say that in spite of all this, what we have discussed, it's a very safe medicine and thousands and millions of people have been benefited by minoxidil in improving their hair growth. So these are few things that you keep in mind while you are using minoxidil for your hair growth. Thanks for watching this video till end. If you like this video, please give a thumbs up and subscribe this channel. If you have any comments, you can write in the comment. We'll get back to you and try to reply your queries. And I hope you like this, and I hope that we can meet sometime in future. And with all that, take care and let's meet sometime in future. Thank you.